When people hear the word ultrasound, they think of a large machine in a hospital imaging department or a technician performing a scheduled scan during pregnancy. But in recent years, point-of-care ultrasound, also known as POCUS, has completely changed how ultrasound is being used in healthcare. And one of the most common questions people ask is this: how is POCUS actually different from traditional ultrasound? Today, we're going to answer that question. At first glance, they may seem very similar. Both use sound waves to create real-time imaging inside the body. Both help clinicians evaluate anatomy, diagnose conditions, and guide treatment decisions. But the biggest difference comes down to speed, accessibility, workflow, and how the technology is integrated into patient care. Traditional ultrasound is typically performed as a formal imaging study. A patient visits a hospital or imaging center, an ultrasound technician performs the scan, and then the images are reviewed by a radiologist or specialist who provides a report back to the ordering provider. This process can work extremely well for comprehensive diagnostic evaluations, but it can also take time. Patients may wait days or weeks for appointments, and providers often have to make decisions before imaging results are available. POCUS is performed directly by the treating clinician during the patient encounter. Instead of ordering imaging and waiting for results, providers can immediately use ultrasound at the bedside, in the exam room, in the emergency department, on the sidelines of athletic events, or even in the field during emergency response situations. The goal is not always to replace comprehensive imaging, but rather to provide rapid clinical insight that helps answer focused questions in real time. For example, imagine a patient arrives in the emergency department short of breath. With traditional ultrasound workflow, imaging may require a separate order, technician availability, and interpretation time. With POCUS, a physician can immediately place the probe on the patient's chest and quickly evaluate for fluid in the lungs, signs of heart strain, or other urgent concerns within minutes. That speed can dramatically impact patient care. The same applies across many specialties. In sports medicine, providers can evaluate muscle tears, tendon injuries, or joint inflammation during the appointment itself. In family medicine, clinicians can assess bladder retention, gallstones, or soft tissue abnormalities without sending the patient elsewhere. In critical care and EMS, POCUS can help identify internal bleeding, cardiac activity, or lung complications in high-pressure situations where every second matters. Another major difference between traditional ultrasound and POCUS is portability. Traditional ultrasound systems are often large, cart-based machines designed for imaging departments or dedicated clinical rooms. While highly capable, they can be expensive and less flexible in fast-moving clinical environments. Vave Health's Universal Probe was designed specifically around the idea of making ultrasound more accessible, streamlined, and practical for modern healthcare providers. Instead of relying on multiple probes for different imaging needs, the Universal Probe combines several imaging capabilities into a single wireless handheld device. Providers can perform cardiac, abdominal, lung, vascular, MSK, superficial, and OB/GYN imaging all from one probe. That flexibility matters because clinicians using POCUS often move quickly between different applications throughout the day. A sports medicine physician may evaluate a shoulder injury in one room and guide injections in the next. An emergency provider may assess lungs, heart function, and abdominal fluid within the same patient encounter. Having one portable device that can handle multiple scan types simplifies workflows and improves efficiency. Another key difference between traditional ultrasound and POCUS is the purpose of the exam itself. Traditional ultrasound studies are often comprehensive and highly detailed. They may involve extensive image acquisition, formal measurements, and detailed interpretation reports used for complete diagnostic evaluations. POCUS is typically more focused and question-driven. Providers are using ultrasound to answer immediate clinical questions such as, is there fluid around the heart? Is the tendon torn? Is there a collapsed lung? Is the injection being placed accurately? Is there bladder retention? It becomes an extension of the physical exam rather than a separate imaging department workflow. That's why many healthcare professionals now refer to POCUS as the new stethoscope. A stethoscope allows clinicians to hear clues about what's happening inside the body. POCUS allows them to actually visualize it in real time. And importantly, this is not an either-or situation. POCUS and traditional ultrasounds can work together. In many cases, POCUS helps providers make faster bedside decisions while traditional imaging still plays an essential role for comprehensive evaluation and long-term management. Healthcare is moving towards faster, more efficient, and more accessible care models. Patients expect quicker answers. Providers need tools that improve workflow and diagnostic confidence, and portable ultrasound technology is becoming a major part of that shift. Ultimately, the difference between POCUS and traditional ultrasound comes down to accessibility accessibility, and immediacy. Traditional ultrasound is typically centralized, scheduled, and comprehensive. POCUS is immediate, portable, clinician-driven, and integrated directly into patient care. And with innovations like the Universal Probe from Vave Health, portable ultrasound is becoming easier than ever for healthcare providers to incorporate into everyday clinical practice. If you want to learn more about the Vave Universal Probe, visit our website, vavehealth.com, or click the link in the description below.